Hi, everybody. Nancy A. here from Professional Movement Solutions. Welcome, members of the Living Well Academy. Today, I want to show you in a video here what I call a standing fascia stretch. And it's a stretch that will allow you more mobility, right? Less stiffness, but also decrease pain. And I want to target it today for our low back and buttock area, even the back of our thighs, even the hamstrings. A fascia stretch, granted, this is going to maybe stretch muscles as well, but fascia, you can think of as cellophane within the layers of our body, right underneath our skin. There is fascia. There is fascia that kind of wraps around our muscle bellies. Again, cellophane is a great analogy. And sometimes, either with injury or just with living our life, it can get tight. It can get hypomobile, that is to say, it doesn't glide along structures like it should, and it can get sticky, for lack of a better term. You may see that if you ever to look it up with what can happen with the fascia. So this is just maybe a tool in your toolbox to help you loosen up your low back from time to time, okay? So a standing fascia stretch. What I'm going to do today is it's done in some different ways and different forms. I'm going to show a way today that it can be done if you have any concerns about bone density, such as osteoporosis or osteopenia. Okay, the key to that and doing it and modifying it for those conditions is a hip hinge. A hip hinge allows you to decrease compressive forces at your spine, but still be able to benefit from the stretch, because it could be a really, really good thing for you, a go-to, if you will, with your activity. So a standing fascia stretch. So what we're going to do, I'm going to show it to you here from the side. And what we're going to do is we're going to bend our knees to start. We have to release these muscles in order to have this hip hinge and the proper posture at our back. Okay, so we're not rounding our back per se. We're using our hips to hinge with, and we're bending our knees to allow that to happen. We're also going to take our hands and walk our way down and support our upper body on our legs. Okay, so it looks like this. Again, we have knees bent. Hip hinge now is happening low here, and we're just coming forward. I'm supporting my hands here. You could come down lower if you have the flexibility. I'm not one of them, but notice the natural curves at my back. That's what's key here. And I now have this gentle, again, like any stretch, it's gentle, a gentle pull starting from up here at my pelvis all the way down to my hamstrings. Okay, and you can just feel that stretch a little bit, and you can use your hands to walk yourself back up, keeping your knees bent. Knees bent is key here. Hip hinge, right? We'll do it one more time. We're going to bend our knees, and we're just going to hinge forward. You know, it's like a deep squat. It's like a deep hip hinge is what it comes down to. And you stop when you start to feel this tension all the way through here. It should feel superficial. That is to say, below the skin. If you ever feel it more to the front of you, and we'll just come up again and walk our way up. If you ever feel it on the front side of you, if it's bad pain, if you know it to be bad pain, joint pain, certainly stop and reassess form. And you're certainly welcome to contact me or your physician for that matter for proper form with this. But again, it should be a gentle stretch along the back. That's it, okay? So a standing fascia stretch, I might do 2 or 3 of these in a series, right? And then you kind of slowly come up and just kind of continue on. You want to be warmed up with this, all right? I would say, that is to say, you don't get up in the morning out of bed and go to do this. Be up and around a little bit, okay? So standing fascia stretch, it might be your most favorite tool in the toolbox, who knows? So if you have any questions, please let me know and keep moving.